The worn scrubs hung on her like a uniform nobody could read. Elena Martinez moved through Cedar Creek Medical's corridors at 6:51 a.m., 20 minutes before the shift officially started, the way people move through spaces that don't fully belong to them. Quiet. Purposeful. Invisible. Dr. Pierce watched her from the nurse's station as she refilled the coffee pot. His eyes tracked the hitch in her left shoulder when she reached for the cabinet, that small catch of breath that came with old injuries, and he smiled the way surgeons smile at problems they're already solving in their heads. She wore scrubs that had been washed 1,000 times, the color faded from surgical blue to something closer to fog. Her badge clipped to her collar read Elena Martinez, RN in letters worn nearly smooth. No credentials stamped after the letters. No advanced practice designation. Just a nurse. He didn't see what the ventilators saw. He didn't see her hands. Elena pulled the coffee down from the shelf, and her hands moved with the terrifying fluid precision of someone who had spent years knowing exactly where everything needed to be. No wasted motion. No hesitation. The muscle memory of 18 years was written in her movements, 8 years before the scrubs, 10 years after. Before Baghdad. After. She poured without spilling. 1 cup. Black. No sugar. Morning, Martinez, one of the residents said, passing by with a stack of charts. Morning, Dr. Chen. Elena's voice came out soft, the kind of soft that doesn't demand space. She kept her eyes on the coffee. The intercom crackled somewhere above them, code blue, 3rd floor, and she didn't look up. Not her code. Not her patient. Not yet. The hospital smelled like it always did. Antiseptic sharp enough to cut. Underneath that, something else, the copper-edged smell of human pain that nobody talked about, the way places where bodies break down acquire their own metallic scent. Elena's nose had learned to sort through it, to find the useful information buried in the odor. Infection. Sepsis. Fresh blood versus old. Other nurses had mentioned that she seemed to know things before the labs came back. Luck, they called it. Intuition. Good nursing. Elena called it reading the room the way other people read books. She finished her coffee by 6:58 a.m., standing at the sink in the break room, watching through the small reinforced window as the hospital woke up. Ambulances pulled in. Staff arrived in clusters, shaking rain from their shoulders. It had been raining since 5 a.m., rain that hammered the glass like applause nobody wanted. The ER doors slid open and shut. Open and shut. A rhythm. Her phone sat silent in her pocket. No messages. No calls. Nobody texted Elena Martinez outside of shift hours. By 7:15 a.m. she was in room for 12, where Mr. Devereaux had coded twice in the night and survived both times by the grace of protocols and persistent people who didn't let him die. His wife sat beside the bed, hands clasped so tight her knuckles had gone white, and Elena moved past her with a kind of presence that didn't intrude. She checked the monitor. She checked the lines. She noted the medication times in his chart with handwriting so precise it looked printed. "How's he doing?" Mrs. Devereaux asked. "Stable." Elena's finger traced the EKG tracing on the monitor. "Sinus rhythm. Good perfusion. He's going to make it." She said it the way people say true things. Not with hope attached. Just with information. It wasn't a request. It was a clinical assessment. Mrs. Devereaux seemed to relax then, the tension draining from her shoulders like someone had just opened a valve. Elena had learned, over the years, that people needed to believe you knew what you were talking about. They didn't care about credentials. They didn't care about titles. They cared about hands that didn't shake and eyes that had seen worse and lived to talk about it. By 8:08 a.m., a code went off on her floor. Room 308. Elena heard the call and moved before she thought about moving, the way soldiers move when they hear incoming fire. She didn't run. Running looked panicked. She walked, very fast, and entered the room to find a patient seizing, monitors screaming in that chaos-specific language that hospitals spoke. The resident on call had frozen, just for a second. That second stretched like honey. Elena was already moving. She assessed the seizure. Tonic-clonic, started approximately 90 seconds ago based on the medication card, and her hands reached for the medication tray. She knew where everything was. She had always known where everything was. The fluorescent lights overhead hummed their industrial hum, and under that, she could hear her own breathing, steady and measured, the way breathing got when you had learned to breathe under pressure. "Call neurology," she said to the resident, who was still holding a tablet. "Tell them generalized onset. 2 minutes duration. Push 0.5 milligrams for." Not a question. Not a suggestion. The medication went in. 30 seconds later, the patient's body began to quiet. The seizure released him like something had negotiated a surrender. Elena reached for the suction and cleared his airway, movements economical and certain, and by the time the attending physician arrived, a man named Soto who had been on staff for 3 years, the room was already organized. The patient was stabilized. The chart was being updated. Elena was taking vitals, her fingers on the radial artery, counting the pulse the way people count breaths at a funeral. "Good work," Dr. Soto said, and he meant it. He glanced at Elena and nodded. A real nod. Not a dismissal. Elena didn't respond. She finished the count. 102 beats per minute. Elevated but stable. Information. Just information. By 10:15 a.m., the hospital had shifted into its daytime rhythm. Admissions had begun. The ER was running at near capacity. Elena had charted on 5 patients, responded to 1 other call for vitals, and refilled the crash carts, a task that most nurses delegated, but Elena did herself because she liked knowing exactly what was stocked, where, and in what quantity. Muscle memory made its own maps. That's when she saw him. The stretcher came through the double doors of the cardiac unit with the kind of ceremonial care reserved for VIPs. Not a president. Not a senator. But the way the residents moved, deferential and precise, told Elena this was someone who mattered. She caught the tail end of the report as she stood at the nurse's station. 73-year-old male, cardiac event 3 days ago, stable post-procedure, transferred for recovery and monitoring. Room 314. Elena's hand stilled. The chart in front of her went soft focus. She knew that face. She had only seen it once, in person, 7 years ago during a deployment ceremony in a hangar at Camp Lejeune where a Marine general had stood in dress blues and pinned a bronze star onto her son's chest. His voice had been rough, the kind of rough that came from giving orders to people who might die. His eyes had been the color of a North Atlantic storm. Lieutenant General Marcus Wade. The stretcher passed her station, and she didn't look up. She had learned, over the years, not to look up. Not to acknowledge. Not to be seen by people from before. The general didn't see her either. Why would he? She was a nurse in worn scrubs with faded insignia on her name badge. She was refilling a chart. She was part of the hospital furniture. But her left hand, the one not holding the pen, had already moved to her pocket. The folded letter was there. It had always been there. Tucked inside her wallet, kept against her ribs like a secret heartbeat. She could feel its edges through the scrub fabric. The envelope was addressed in careful military script to Captain Martinez's family, on the occasion of Marcus's advancement. Inside, 7 years of careful storage had made the paper soft as cloth. She had read it maybe 200 times. She knew every word. Elena pulled her hand away from the letter and went back to charting. Room 314. She confirmed it silently, filing the information into that part of her mind that never forgot anything. The room assignments were already updated on the monitor. She could see the bed layout, the monitoring setup, the medication schedule. Dr. Pierce appeared at the station then, moving with that particular kind of casual entitlement that expensive education had taught him. He had a coffee cup in his hand, actual coffee, not the break room disaster, and he was reviewing the new admissions list on the monitor. His eyes moved down the roster. When he reached room 314, he paused. His entire demeanor shifted. The casual confidence hardened into something more deliberate. "Who's the primary on the cardiac recovery?" he asked. "Nobody in particular." Dr. Holloway, one of the residents offered. "Cardiothoracic specialist." "Consulted from Methodist." Dr. Pierce made a small noise, something between a laugh and a dismissal. He set his coffee down on the counter, not carefully, but with the deliberate carelessness of someone marking territory, and looked directly at Elena for the first time that morning. "This patient is high profile," he said. "Military, I believe. We'll need to be especially careful about continuity of care." Elena looked up from her charting. Her eyes met his for exactly 1 second. 2. Then she returned to the chart. "Understood, doctor. The nurses on this assignment should be carefully selected." He smiled, but his eyes had gone flat. "Experienced. Someone with the right background for this level of care." Elena's pen kept moving. The chart filled with her handwriting, vital signs, medication times, clinical observations. Each letter precise. Each word economical. She had learned, a long time ago, how to listen to what was being said without reacting to it. How to absorb threat the way walls absorb bullets, recognizing the impact, registering the damage, but not falling down. Dr. Pierce was still watching her. His coffee sat cooling on the counter, and his attention had become the kind of attention that precedes decisions. The kind of attention that changes shift assignments. The kind of attention that starts wars. Elena finished her entry, closed the chart with a soft click of the plastic closure, and stood. "Anything else, doctor?" Her voice came out exactly the way she had trained it 18 years ago. Deferential. Soft. Invisible. "No." He picked up his coffee. "Not yet." He walked away, and Elena stood at the nurse's station, listening to the hospital breathe around her. The ventilators in the ICU section were running their mechanical rhythm. Somewhere down the hall, a monitor was beeping. Normal. Steady. The kind of sounds that meant people were still alive and being kept that way by precision and protocol. She touched the letter in her pocket one more time. Lieutenant General Marcus Wade was in room 314, and Dr. Pierce had just decided something about her. She could feel it, the way you can feel pressure changes in the air before storms arrive. Grand rounds at Cedar Creek Medical happened every Tuesday at 0800. 12 resident physicians clustered like students around a master, and Dr. Pierce had positioned himself at the center of the conference room like a conductor before an orchestra he'd personally trained. Elena stood against the back wall, chart in hand, watching the familiar choreography, the way his voice modulated from professorial warmth to surgical contempt depending on whether the residents were nodding or questioning. She'd learned to read rooms the way soldiers read terrain. Then he held up her charting. "This," Dr. Pierce said, elevating the folder between his thumb and forefinger as though it smelled of something rotten, "is what happens when we lower our standards." The residents exchanged glances. Some smiled. One resident, a third year who'd watched Elena stabilize a septic patient at 0300 while he slept, looked at his shoes. "Adequate for a strip mall clinic, perhaps," Pierce continued, his voice settling into that particular register of disappointment reserved for subordinates he'd decided were beneath him. "But adequate is not Cedar Creek. Adequate is not what we do when we're treating actual heroes." The room went dead silent. Elena's jaw didn't clench. Her breathing didn't change. Her hands, steady as surgical instruments, remained crossed at her waist. She'd learned compartmentalization in field conditions far worse than this, the kind of silence that came right before incoming fire, the kind of calm you had to build inside yourself or it would never exist at all. She watched Pierce's face settle into satisfied contempt as the residents absorbed his performance, as the hierarchy re-established itself in real time. He wanted a reaction. Trembling. Embarrassment. Retreat. She gave him nothing. Later, at the vending machine outside the ICU, the fluorescent lights humming their tired frequency, Elena fed $2 bills into the slot. She didn't hear him approach. She'd heard plenty of men approach in her life, and some of them had been trying to kill her, but she felt the air pressure change when Pierce positioned himself between her and the exit. His coffee breath came before his words, heavy and bitter, the smell of someone who'd been awake since before dawn, steaming in condescension. "You know, nursemaid," he began, his voice low enough that the passing orderly wouldn't hear, "you'd be far more comfortable somewhere that doesn't treat people who actually matter." His eyes flicked sideways toward room 314, the Marine General's recovery suite down the hall, and Elena understood the full architecture of his calculation in that single glance. This wasn't about her charting. This was about leverage. Control. The instinctive move of a man who'd learned power through institutional channels rather than genuine competence. She selected her snack, coconut water, because hydration was data, and data was survival, and turned to face him directly. The eye contact was the first thing he hadn't expected. "I've seen what actual heroes look like, Doctor," Elena said, her voice dropping to a frequency that made Pierce take an involuntary step back. "And they don't need an audience to prove it." She held his gaze for exactly 3 seconds, long enough for him to understand that whatever calculation he'd been running had just produced unexpected results, then walked past him toward the ICU floor, her badge swinging against her chest like a metronome keeping time to a rhythm only she could hear. His smile curdled into something uglier. She didn't look back. But she heard it in the quality of the silence behind her, the moment a professional humiliation transformed into something deeper, something that required destruction to satisfy. That night, Dr. Pierce didn't sleep. The next morning, he began his campaign in earnest, and it was here that his competence became visible. This wasn't loud bullying. This was strategic. By Tuesday afternoon, he'd reassigned the 3 veteran nurses who'd specifically requested shifts with Elena, citing workflow optimization, citing seniority considerations, citing documentation so precise that HR couldn't challenge a single decision. The nurses moved to different floors without protest, understanding the power mathematics the same way Elena did. He altered the master schedule so she'd never be assigned alone to high-profile patients, always paired with residents or newer staff who wouldn't carry the weight of her clinical judgment as a counterbalance to his authority. He restricted her computer access to basic charting functions, justifying it through protocol compliance and segregation of duties. Each move was documented. Professional. Built to withstand scrutiny. Elena said nothing. Kept her head down. Returned to her work with the kind of mechanical precision that was either acceptance or the most elaborate form of resistance, even she wasn't certain which anymore. By Wednesday, the break room conversation stopped when she entered. She could see it happening in real time, the small adjustments in body language, the way voices trailed off mid-sentence, the sudden intensity of focus on coffee cups and phone screens. This was what institutional isolation looked like when conducted by someone competent. No overt cruelty. No rules violated. Just the slow, patient removal of professional recognition, accomplished through a series of decisions that were individually defensible and collectively devastating. She'd trained for hostile environments, but hostile environments where you could see the enemy. This was different. This was the kind of war conducted in policy compliance and schedule optimization, fought with credential questions whispered during staff meetings, carefully phrased concerns about unverified documentation, liability risks, the importance of maintaining standards, the kind of soft language that felt like kindness right up until it destroyed your ability to work. By Friday, 3 weeks into her assignment at Cedar Creek, Elena had become functionally invisible to everyone except the patients who asked for her by name when they were scared, when pain had burned away their ability to trust titles, when the machinery of institutional hierarchy had proven useless against genuine medical crisis. Room 314 was where the Marine General lay recovering from post-operative complications following cardiac surgery, a slow mend, careful vitals monitoring, the kind of case that required clinical judgment rather than heroic intervention. Elena had recognized him the moment he arrived, though she'd kept her face neutral, her voice professional, her distance absolute. General Marcus Wade. The commander who'd pinned the Bronze Star on her son's chest during the 2017 Baghdad deployment. The man whose letter she kept folded in her wallet, the one that mentioned how her son had carried a wounded Marine 200 meters under fire because someone had taught him what courage looked like. She'd never spoken to the general beyond basic medical pleasantries. Terrified of recognition. Terrified of what his eyes might do if he saw past the scrubs and the hospital ID, if something in her face triggered the memory of a classified medevac operation that had officially never happened, of a call sign that was supposed to be buried, of a woman named Elena Martinez who'd officially died in a drone strike over Baghdad 7 years ago. Then the contractor arrived at 22:47 on a Thursday night. Critical GSWs, multiple entry wounds, sedated but restless, the kind of trauma that made everything else stop. Dr. Pierce personally supervised the admission, making a show of clinical command, ensuring the residents saw his decisiveness, his authority. The man's files were incomplete, Syria extraction, private security detail, all the details redacted or vague, but the injuries told their own story. Professional gunshot wounds. Combat medicine in someone else's war. Elena was restocking the supply cart when the contractor briefly surfaced from sedation, the kind of semi-conscious moment where bodies move independently of intention. His eyes opened. They found her across the trauma bay, standing in her peripheral position, exactly where she always stood, visible but not prominent, essential but unnoticed. His lips moved. Formed words in accented English that made her blood stop in her veins. Phantom 6. The call sign. The unit designator. The name that belonged to a woman who no longer existed. Elena's hands continued moving, restocking the same supplies, her face never changing. But her mind was running tactical assessments at combat speed. Who knew she was here? Who'd seen the recognition? How long before the trail led back to her? How long before questions began that she couldn't answer without revealing 7 years of documentation that was supposed to be sealed, classified, permanently redacted from any official military record? Dr. Pierce hadn't heard it. The monitors were too loud, his attention too focused on the man's vitals, his need to be seen as competent too absolute to notice the silent exchange happening 10 feet away. But Elena had heard it. And she understood with absolute clarity that her time at Cedar Creek Medical had just collapsed from uncertainty into imminent disaster. The contractor's whisper hung in the hallway like a grenade with the pin pulled, and Elena understood in that crystalline moment of clarity that her time at Cedar Creek Medical had transformed from precarious into terminal. She didn't move. She didn't acknowledge the man who'd just spoken her call sign, the operational name that was supposed to have died in a drone strike over Baghdad 8 years ago. Instead, she pivoted back to the medication cart, her hand steady as a surgical laser, her jaw clenched so tightly her molars ached. Behind her, she heard Dr. Pierce's footsteps quicken, heard him asking the contractor sharp questions about his service record, about which units, about where exactly in Syria he'd been extracted from. The doctor was fishing. He'd heard something in those 2 words that didn't fit. He didn't know what Phantom 6 meant, but his instincts for weakness were lethal, and he was already calculating how to weaponize whatever he found. By 02:47 hours, Elena was covering the night shift alone, a change that had appeared on the schedule 3 days earlier with no explanation. She'd worked nights before, plenty of times, but never in the pattern Dr. Pierce had engineered. Every veteran patient had been reassigned. Every nurse who'd asked for her by name during critical moments had been pulled to different units. The night nurse who specialized in post-op cardiac care, a former Army medic named Garrett who trusted Elena instinctively, had been transferred to pediatrics effective immediately. The policy shift was implemented through channels so professional, so methodical, that Elena couldn't articulate it as sabotage without sounding paranoid. It was just scheduling optimization. It was just resource allocation. It was just that the general was stable enough now that he didn't require specialized care. Her computer access had been restricted to basic charting that morning. No labs. No imaging review. No access to Dr. Wade's clinical history or medication list beyond what appeared on the printed chart at the bedside. The hospital IT manager, a man named Richardson with the bearing of someone who'd spent time in uniform, had delivered the notification in person, looking deeply uncomfortable as he explained that new credentialing protocols required limited access for nursing staff without advanced certifications. Elena had just nodded and said thank you. She didn't flinch. She didn't ask questions. The mask stayed in place, the carefully constructed persona of a competent but unremarkable RN, someone nobody needed to think about twice. The calls had started at 1,600 hours. She'd overheard them from the supply room where she was inventorying medication trays. Dr. Pierce's voice carried through the thin walls of his office, smooth and conversational, painting the general's advance directive as a liability minefield. The hospital legal team needed to understand the complexity, he explained to someone on the line, probably the chief of staff. The general was a high-profile patient with classified military history and complex end-of-life documentation that had been prepared by Pentagon counsel. If anything happened, if the family had questions, if the VA filed a complaint, the hospital could be exposed to regulatory action. He was just flagging it. Just being cautious. Just making sure everyone understood the risk landscape. By 1845 hours, he'd called the department heads. Elena knew this because she'd answered a transfer line when the ICU director tried to reach the ER attending and ended up getting Dr. Pierce's voicemail instead. The message played through the open phone line before she could transfer it. "Marcus, it's Harrison Pierce. Calling about our post-op cardiac patient in 314. I've been reviewing his chart and I'm seeing some red flags about advanced directive compliance. Nothing we can't manage, but I think the legal team should weigh in before we continue escalating care. Just want to make sure we're all on the same page." By the time Dr. Pierce disconnected, the seed had been planted. The seed that said, "This patient is complicated, this patient is risky, this patient might sue us." At 1930 hours, she'd heard him on the phone with the hospital administrator. His tone was different then, deferential, almost worried. He was expressing concerns about the clinical decision-making surrounding the general's case. Not his concerns specifically, he was just reflecting what he'd heard from other members of the care team. He was just trying to make sure the hospital wasn't exposed to liability. He respected the general's service, of course, but medicine had to come before sentiment. The conversation lasted 7 minutes. When Dr. Pierce hung up, Elena heard him lean back in his chair, heard the leather creak with satisfaction. She'd mapped it all out during her break, sitting in her car in the Cedar Creek Medical parking lot with the engine off and the San Antonio heat pressing down like a physical force. The pattern was too clean to be coincidental. The reassignments weren't random. The schedule changes weren't about optimization. The computer access restrictions weren't policy, they were targeted. He was isolating her methodically, surgically, the way you'd remove a tumor from a critical organ. He was doing it all through official channels so that nothing could be challenged, nothing could be grieved, nothing could be proven as anything other than routine administrative adjustment. And the phone calls were the architecture that would ensure the general received care from someone other than her, from someone who would follow protocol, from someone Dr. Pierce could control. At 0247 hours, Elena was 4 hours into her shift when the monitor alarm screamed through room 314. Not a warning beep. Not a gentle alert. A full cardiac distress alarm, high-pitched and insistent, cutting through the quiet of the night ward like an air raid siren. She was at the medication dispensary 2 hallways over, counting antibiotics into a tray, and her body responded before her conscious mind could catch up. Muscle memory. The same muscle memory that had taught her to move toward the sound of incoming fire instead of away from it. Room 314 was dark except for the monitor glow and the lead strip above the bed casting its sickly green surveillance light. General Marcus Wade was sitting up, his breathing ragged and wrong, his neck veins distended like ropes beneath his skin. The oxygen saturation number on the monitor was dropping in real time, 85, 83, 81, and his breathing had that peculiar sound that only someone trained in emergency medicine could recognize as the marker of catastrophic respiratory compromise. His trachea was deviated. The left side of his chest wasn't rising with inspiration. The presenting signs arranged themselves in Elena's visual cortex like a tactical briefing. Tension pneumothorax. Collapsed lung. Air in the pleural space creating pressure that was collapsing his cardiovascular system. The on-call resident, a third-year named Collins who'd arrived at Cedar Creek exactly 6 weeks ago, was standing at the foot of the bed with his phone in one hand and his other hand pressed against his sternum, making small repetitive motions like he was conducting an invisible orchestra. The oxygen saturation was 77 now. The general's face had taken on that peculiar grey cast that meant shock was deepening, meant they were approaching the event horizon where the body's compensatory mechanisms would fail and the collapse would become irreversible. Elena reached for the needle decompression kit before anyone told her to, before anyone asked if she was qualified, before anyone said anything at all. Her hands moved on their own, finding the 14-gauge angiocath needle in the emergency airway tray, the needle that would puncture the second intercostal space at the midclavicular line, that would release the air that was suffocating the general from the inside out. The resident made a sound, not quite a word, more of a strangled protest, and took a step backward, his phone now clutched to his ear though no one had answered. "You can't," Collins was saying to the phone, to someone who didn't exist yet on the other end of the line. "That's outside, she's not, protocol says." Elena wasn't listening. She'd already cleaned the site with a betadine wipe, already palpated the landmarks with her fingertips, already felt the space between his ribs open like a doorway. The general's eyes found hers for exactly 1 second, and in that second she saw recognition, not of her identity but of her competence, the understanding that the woman standing over him knew exactly what she was doing. His breathing had become so shallow it was barely visible now. Oxygen sat down to 71. The monitor had stopped shouting and moved into the peculiar quiet that meant imminent cardiac arrest, that meant approximately 90 seconds of viable tissue remaining. The needle went in smoothly, found the correct fascial plane, and Elena heard the sound that meant the procedure had worked, the distinctive hiss of air escaping from the pleural space, the audible pressure release that was half science and half miracle. The general's body convulsed once, deeply, as if his lungs were remembering how to breathe. The oxygen saturation ticked upward immediately. 74, 78. 82, his chest rose and fell, the mechanical rhythm reasserting itself like a diesel engine turning over after years of dormancy. Collins had finally connected with someone on the phone. "Yeah, we have a situation in room 314. The nurse just performed a needle decompression without authorization." "Yes," I said the nurse. "I don't know, she didn't wait. The patient was coding out, I understand, but yes, I'll document it. Right now." Elena was already moving, already preparing the equipment the general would need for a proper chest tube placement, already running through the mental checklist of what came next because the needle decompression was a bridge procedure, a temporary fix that bought time but didn't resolve the underlying pneumothorax. The general needed a tube, needed a drainage system, needed monitoring in an ICU where people would be watching him constantly through the night. Behind her, Collins was still on the phone, his voice climbing in register as he explained to whoever answered that yes, the patient was stable now, yes, the nurse knew what she was doing, no, he didn't know why she had that level of training, and no, he couldn't prevent her from. The hallway outside the room filled with footsteps before anyone asked permission to enter. Dr. Pierce appeared in the doorway with his phone still pressed to his ear, and behind him came hospital security, 2 men whose bearing suggested they'd been told this was urgent, and behind them came the charge nurse looking as if she'd been dragged out of the break room mid-bite of a sandwich. Dr. Pierce's eyes moved across the scene with surgical precision, the general still connected to the now calming monitor, his oxygen saturation steady at 88 and climbing, his breathing regular and strong. And Elena standing beside the bed with the used needle decompression kit in her hand, her scrub still dry, her face showing absolutely nothing. The silence lasted exactly 3 seconds. Then Dr. Pierce disconnected his phone call and smiled, and it was the kind of smile that belonged on a predator recognizing that its prey had finally made the mistake it had been waiting for. He turned to the security officers without saying a word to Elena, without acknowledging her or the general or Collins or anything in the room except the narrative he'd already constructed. "This is the situation I've been warning about," Dr. Pierce said, his voice perfectly modulated, the tone of a concerned physician doing his duty. "An RN performing invasive procedures without physician authorization, without proper oversight, potentially violating the advance directive we've all reviewed. I've already contacted the Chief of Staff and the legal team about the liability concerns with this patient's case. This situation has now escalated beyond what we can manage independently. I need this nurse removed from patient care pending investigation." Before Elena could respond, Dr. Pierce made a series of phone calls from the hallway outside room 314, each one more systematic than the last. The first was to the Chief of Staff, who'd already been primed by the earlier conversation about advanced directives and liability. The second was to the department heads who'd received the voicemail earlier in the evening. The third was to the hospital legal team, who were now fully invested in the narrative that the general's case was too complicated, too risky, too laden with regulatory exposure. By 03:20 hours, Dr. Pierce had accomplished what he'd been building toward since Elena first walked into Cedar Creek Medical. He'd created a situation where 15 doctors had officially consulted on the case and 15 doctors had officially recommended against any further intervention beyond basic supportive care. 15 physicians, each one protecting his own license, each one terrified of the liability Dr. Pierce had so carefully, so methodically, injected into their decision-making. The general would be stable through the night. The needle decompression had bought him time, had prevented immediate cardiac arrest, had given his body the chance to remember how to breathe. But by morning, the entire medical staff would be united around a single narrative, that the patient was too complicated, that the legal exposure was too great, that continuing aggressive care would violate the advance directive that Dr. Pierce had spent the entire evening reinterpreting as a prohibition against intervention. And Elena would be the reason this had happened, the reckless nurse who'd overstepped her authority, who'd created the legal nightmare that now everyone wanted to escape. The monitor screamed at 0300. Elena was 3 floors down, restocking the med cart on 2 South, when the code alarm pierced through the ceiling speakers. Room 314. Her hand stopped moving. She didn't have to check the assignment board. She already knew who was in 314. The general. She moved toward the stairwell. Not running. Never running. That was how people made mistakes. But her pace was the pace of someone who had answered similar alarms in places where the ground shook from incoming mortars, where every second between decision and action meant a life folding into itself. The fluorescent lights buzzed overhead like angry wasps as she climbed. The corridor outside 314 was chaos pretending to be order. 2 residents stood outside the room, hands empty. A nurse stood frozen near the vital station, eyes wide, clutching a clipboard like it might explain something. The monitor's rhythm was a jagged scream, oxygen saturation falling like a stone drop down a well. 68%. Falling. 65. Elena pushed into the room and saw it immediately. The general's neck was swollen on the right side, the veins bulging purple and taut like rope underwater. His trachea had shifted visibly to the left, his breath coming in shallow gasps that made his whole chest heave. The ventilator was still pumping air into lungs that weren't accepting it. Classic signs. Textbook presentation. Tension pneumothorax, air pocketing in the pleural space, collapsing the lung, compressing the heart, turning his chest into a trap that was suffocating him from the inside. His saturation still dropping, the resident said. His voice was thin. Useless. Elena moved to the crash cart and opened the needle decompression kit with hands that remembered Baghdad, the 0300 calls there too, the darkness, the ambient sound of distant gunfire that told you the medevac was running out of time. The kit opened like a ritual. 14-gauge angiocath needle. Syringe. The landmarks were burned into muscle memory, second intercostal space, midclavicular line. Between the ribs where the lung had collapsed into itself. The general's skin was clammy under her gloved fingers. She found the rib spaces, 1, 2, and palpated the landmarks with the precision of someone who had done this under fire, with rounds impacting the ambulance hull, with a Marine corpsman bleeding out beside her. The needle was cold against her palm. She didn't hesitate. Never hesitate. The needle went in. The hiss came immediately, a sound like a tire deflating, like pressure finding its release. The air that had been killing him escaped into a syringe and suddenly his chest could move again. His oxygen saturation began to climb. 70. 75. 80. The monitor's rhythm softened from a scream into something approaching a rhythm again. Get a chest tube kit, Elena said to no one in particular. Call CT. We need imaging on this. The resident moved. The nurse moved. The room shifted from paralysis into function. That was when Dr. Pierce appeared in the doorway. He was flanked by 2 security guards, the kind of men whose job was to remove problems from hospitals, whose presence in a patient room meant the decision had already been made before anyone asked a question. Dr. Pierce's face held the expression of a man who had been waiting for this exact moment, who had orchestrated every piece of this night like a conductor with perfect knowledge of the score. "She's performing procedures outside her scope," Dr. Pierce said. His voice was calm. Almost pleasant. That was worse than anger. Anger burned itself out. This was ice. "Escort her from the building. Now." One of the guards stepped forward. His hand came up, not aggressive, just indicating the direction. "The door. The hallway. Departure." Elena looked at the general. His color was already improving. The oxygen was reaching his tissues again. The resident was calling for the imaging team, actually doing the work that mattered. She set the needle decompression kit on the bedside table where it could be seen, where no one could pretend it hadn't worked, where the visible result spoke louder than any accusation. "He'll need continuous monitoring," Elena said to the resident. "Not a request. Instructions." Her voice had dropped an octave without her noticing it happen. "Chest X-ray stat. If the pneumothorax is worsening, he's going to need surgical intervention. Watch his vitals. Anything changes, call me." She didn't look at Dr. Pierce as she passed him. That was the only power she had left, the refusal to give him the satisfaction of her eye contact, the refusal to acknowledge that he had won anything at all. Her scrubs were still wet from the night shift, still stained with the work of keeping people alive. She walked between the 2 security guards like a prisoner of war who had decided that dignity was the only thing they couldn't take. The hallway was a tunnel of fluorescent lights and polished tile. Behind her, she could hear Dr. Pierce on his phone, already rewriting the incident report, already constructing the narrative where her unauthorized procedure had created liability instead of saved a life. 15 doctors had already walked away from the general's case after Dr. Pierce's coordinated calls that afternoon. 15 physicians whose fear of legal exposure was greater than their duty to a Marine officer who had bled for this country. 15 competent medical professionals reduced to bystanders by a man with a phone and a vendetta. The security guards walked her to the employee exit. One of them actually held the door, a gesture so absurdly polite that it made the removal feel even more official, even more final. Cedar Creek Medical's night shift parking lot was empty. Her car was 3 rows back, a Toyota that smelled like stale coffee and the phantom scent of antiseptic that never quite washed out. The night air hit her like cold water. It was mid-March, and the spring cold hadn't yet broken into genuine warmth. She still wore her scrubs. She hadn't stopped to change. She hadn't thought to grab her jacket, the one with the faded 3rd Battalion patch sewn inside the lining, the one piece of identity she was allowed to keep if she kept her head down and her mouth shut. She drove home with the windows down. For hours later, her son found her at the kitchen table, still in her scrubs, with her hands folded in front of her and something that might have been tears but could also have been exhaustion making her eyes bright. He was 12 years old and still in his pajamas, still carrying the innocence of a kid who didn't understand that promises sometimes cost everything. "Mom." His voice was cautious. He had learned not to ask questions when something was wrong. Elena looked at her son, his face carrying the angles that would someday look like hers, his eyes carrying his father's dark brown, and felt something inside her crack like old concrete. "I'm home early, baby," she said. It was the only truth she could afford to tell him. He didn't ask why. He sat down across from her at the table and didn't speak either. The kitchen was silent except for the sound of the refrigerator humming its monotone song. Outside, the first birds were beginning to sing. Somewhere in San Antonio, in room 314 at Cedar Creek Medical, a Marine general was breathing again because of a captain who was no longer permitted to practice nursing. Somewhere in the hospital, Dr. Pierce was making phone calls to solidify the narrative of her removal. And in the kitchen of a modest house in San Antonio, a boy sat with his mother and understood, without being told, that something fundamental had shifted. The fluorescent hum of the kitchen light seemed impossibly loud. That night, her son found her at the kitchen table still wearing her scrubs, the fabric damp from the rain outside. Elena's hands trembled, not from fear, but from the weight of containment, the effort of holding everything back. He didn't speak. He just sat across from her and waited, the way kids do when they've learned not to push. "I'm home early, baby," she said. That was all. That was everything she could say without breaking the only promise that mattered. He studied her face like he was trying to read classified documents. 16 years old and already learning that some wounds don't bleed. Elena could see the questions forming behind his eyes. Why the tears? Why the silence? Why the way she kept pressing her palm against the scar tissue on her ribs like she was checking if her heart was still in there? But he didn't ask. He just moved his chair closer and sat with her until the fluorescent kitchen lights stopped humming quite so loud. What she couldn't tell him was that Captain Elena Martinez, decorated combat medic, Bronze Star recipient, extraction specialist with the 3rd Battalion 5th Marines, officially died in a drone strike outside Baghdad 7 years ago. The death certificate was in a vault at the Pentagon. The obituary was classified. The woman who sat at this kitchen table in San Antonio was a ghost who'd promised never to manifest, never to be anything more than Elena the quiet nurse, the one who didn't talk about her past, the one who came home and made dinner and asked about his day. Except she'd broken that promise to save the general's life. She'd let the mast slip for 40 minutes in a burning Humvee, and now there was nowhere left to hide. The nightmare unfolded over the next 3 days. Elena moved through the house like a phantom, waiting for the government to come knocking, waiting for the hospital lawyers to call with news of investigation, waiting for something worse than silence. Her clearance was revoked. Her credentials were flagged. Her testimony to security had been documented and filed somewhere that would haunt her for decades. She'd surfaced. She'd been seen. And somewhere in a classified database, someone was updating a file that said Captain Elena Martinez was no longer missing. Then the trauma rolled in. It was a contractor extraction from Syria, what the intake paperwork called a tactical medical airlift, which meant someone had gotten hurt doing work the government wouldn't name in a place it wouldn't acknowledge. Elena was off the schedule, banned from patient contact, ordered to observe from the observer's gallery while junior nurses handled the intake. She stood behind glass, watching the emergency team work, and watched the man's eyes snap open as he turned his head. He saw her. His eyes went wide. His lips moved around a single word, and even from behind the glass, she could read it, Phantom 6. Only her unit knew that call sign. Only the Marines in her squad. Only the people who had bled next to her in Fallujah, Jolan district, where the temperature hit 127 degrees and death came down from every roof. Only the people she was supposed to never contact again. The man's hand moved. His monitors spiked. A resident rushed to sedate him, but those eyes never left hers. He knew. He knew exactly who was standing behind that glass watching her entire classified existence collapse in real time. That was when General Wade, recovering faster than a man his age had any right to, walked out of his room against every doctor's order. He moved like a man who'd spent 62 years knowing exactly what he was walking toward. He stopped at the observation window, followed Elena's gaze, and saw the recognition in the contractor's vital signs. He didn't ask questions. He didn't say a word. He just walked directly to her locker, opened it with the kind of authority that made security guards step aside without protest, and pulled out the jacket she'd worn on her first day at Cedar Creek Medical. The faded 3rd Battalion patch was sewn inside the lining in stitches so precise they looked like they'd been done by someone who'd performed field surgery in the dark. General Wade's hands, steady as a surgical laser, found it immediately. He walked into the hallway with that jacket and 30 seconds later, he was standing at attention while he read from his phone. His voice carried down every corridor in Cedar Creek Medical, clear and precise as a command at attention. Captain Elena Martinez, Navy Cross citation for actions under fire while extracting wounded Marines under direct enemy contact in Baghdad's international zone. Citation, for extraordinary heroism and devotion to duty, Captain Martinez demonstrated the highest degree of professional valor while providing medical support to a platoon engaged in sustained combat operations against an enemy force of superior numbers and firepower. Despite incoming fire from at least 4 distinct positions, Captain Martinez exposed herself to direct enemy contact to reach 3 critically wounded Marines. She maintained medical care on all 3 casualties while moving them to the extraction vehicle, returning fire with one hand while administering emergency treatment with the other. When the primary Humvee took indirect fire and caught fire, Captain Martinez remained inside the burning vehicle and provided open chest wound management for Staff Sergeant Jackson for 42 minutes while the vehicle was recovered. Her actions directly resulted in the survival of 7 Marines who would have died without immediate intervention under active fire. Dr. Pierce appeared in the hallway, his face already working its way toward white. He stepped forward, tried to interrupt, insisted this was a psychological episode that needed immediate containment. But General Wade's voice rolled over him like tank treads, and there was no mercy in it. This woman carried my Marines through gunfire when their own corpsman was down. Held a sucking chest wound closed for 40 minutes in a burning Humvee. Never asked for recognition. Never asked for anything except to do her job. And your hospital fired her for it. A Marine colonel appeared, boots clicking on the tile like a metronome counting down Dr. Pierce's career. Behind him came a Pentagon courier with credentials that made hospital security stand down immediately. Your security clearance has been reinstated, the courier said. Full level as of 0800 this morning. The IT guy, Collins, a former Army sergeant with a frame like a command center and eyes that had seen too much, stepped forward next. He held a tablet and spoke with the kind of casual precision that comes from having documented everything. Dr. Pierce deleted patient files. Erased her credentials from our system. Made calls to the legal team with false statements about the General's advance directive. Doctored the incident report on the needle decompression. I have it. All of it. Security footage. Recording of every phone call. Timestamps showing he deliberately delayed the General's care authorization. Already submitted to the State Medical Board. The footage came later, showed everything, Dr. Pierce in the server room at 2:43 a.m. deleting files. Dr. Pierce on the phone telling the Chief of Staff that Elena's credentials were unverified. Dr. Pierce making the same false liability claims to 15 different doctors, telling each of them different stories to manufacture the abandonment. The advance directive was never complicated. It was never a legal trap. There had been no legal justification for any of it. The 15 doctors all received subpoenas. Their statements contradicted each other completely. Some said Dr. Pierce had told them Elena wasn't properly licensed. Others said he'd claimed the General's care directive was legally ambiguous. A few admitted they'd simply deferred to his authority without asking questions. The manufactured concerns evaporated under investigation. The legal risks that had seemed so overwhelming were revealed as fiction. Dr. Pierce's fiction spread like infection through the hospital's trust structure. Within hours, he was suspended pending investigation. He tried to delete files remotely, but Collins had locked him out and backed everything up to 3 separate servers. His allies vanished. The department heads who'd taken his calls suddenly couldn't remember specific conversations. The Chief of Staff ordered a full audit of every case Dr. Pierce supervised over the past 5 years, and they found a pattern: altered charts, delayed treatments, retaliation against anyone he deemed a threat to his authority. The Marine colonel requested a military investigation into whether Dr. Pierce's interference constituted obstruction of care for an active senior officer. It wasn't a suggestion. It was a command. By the end of the day, Dr. Pierce was escorted from the building by the same security guards who'd removed Elena 3 days earlier. His hands shook so badly he could barely hold his badge. The man who'd orchestrated her exile with surgical precision was now walking into obscurity, and he didn't even have the composure to hide it. But that wasn't the worst part for him. Not really. 6 months later, Elena stood in dress blues, the crisp uniform with the medals arranged in ascending order of prestige, Bronze Star and Navy Cross catching the light like they were still brand new, and watched her son raise his right hand at his own enlistment ceremony. He was 17 now, having joined early with her permission, and for the first time in his life, he understood why his mother had come home early that night in scrub soaked with rain and tears. General Wade stood beside them, still moving with the authority of command, and pinned the new insignia onto her son's uniform. "Your mother is why I'm standing here," the general said. "Why 9 Marines went home to their families. Why we never leave our people behind." Her son looked at his mother then, really looked at her, and saw something he'd been searching for his entire life, the reason. The wound. The impossible choice she'd made to break her own exile, to surface from the dead, to save someone because that's what you do when you've already died once for your people. After the ceremony, a young nurse approached Elena. Former Army medic, fresh out of uniform, struggling with PTSD and the way civilian hospitals didn't understand what it meant to work under fire. Elena recognized the look, that particular weight of carrying knowledge no one in your civilian life would ever understand. "Walk with me," Elena said. Her voice had changed over 6 months. The deferential edges were gone. What remained was command, and also something deeper, the kind of calm that comes from having already survived the worst. As they left the ceremony hall, Elena's son watched his mother guide another invisible warrior into the light. The contractor from Syria was there, in civilian clothes, watching from the back. General Wade was there, standing at ease like he always would. Collins the IT guy was there, standing with the quiet authority of someone who'd protected the truth. And Elena understood, finally, that the hardest part wasn't the hiding. It wasn't the false death, the buried life, the promise never to surface. The hardest part was watching your son grow up thinking his mom was just a nurse who came home early and cried at the kitchen table for reasons he'd never understand. The hardest part was the silence. The hardest part was being a ghost in your own house. But ghosts could become legends. And legends could change everything. If you made it this far, you already know the truth. The ones who have seen the worst often give the most. Subscribe for more stories about people who carry invisible battles. Leave a comment, tell us about a time someone underestimated you and lived to regret it. Like this video and share it with someone who needs to hear that strength looks different than we expect.